Right now on Friends at 5, we are talking from health officials who have confirmed the first case of the measles in the state this year. The Department of Public Health says the patient was unvaccinated and did not have immunity from a previous measles infection. Joining me right now is epidemiologist Dr. Linda Bell. Thank you so much for your time. I do want to ask, where was this confirmed case in South Carolina?
The case occurred in someone who lives in our upstate public health region.
Okay, so then my biggest question is for families who are watching, what's next after hearing this news?
Well, when we were notified of this case, we immediately initiated an investigation of possible contacts who could become infected. And so we've completed that contact investigation, and we're pretty confident that we've identified anybody that could be at risk and are taking the appropriate measures to prevent further spread. So what's next is monitoring those who are not immune, making sure that no one else is a close contact should come down with measles. And then we just maintain our regular surveillance activities for any other possible cases.
Okay, Dr. Bell, how can I protect my family?
Well, you mentioned that this case was unvaccinated. And really the best protection is vaccination. It is highly effective. This is a very easily spread disease, and so really the best way to protect yourself is to have that vaccination.
Now, you also told me, or we talked about during the commercial break, it's almost back to school time. We have so many students who are thinking about the vaccinations, the requirements for schools. So what would be your message to parents?
Well, you can imagine in school settings, when you have a highly transmissible disease like this, we want those kids to be protected. So we are in that season now to make sure that kids are receiving all of the required vaccinations for school and child care attendance. And this is really the time for parents to be thinking about that so that there are no delays and that there are no risks of disease spread in our schools.
Okay, I know a lot of parents hear this story and the alarm bells, they go off, right? Should we panic?
No, there's no reason to panic. It's just to be prepared. And so we don't have an immediate threat of measles in this state from this particular case. However, we are monitoring the really high number of cases that are occurring in the United States. And this is a really instructive lesson about the importation of cases from this particular case. And so no reason to panic, but we really need to be aware of what's going on in the rest of the country, and the fact that we can have an imported case here at any time that we may not know about, that we can't identify the close contacts, and we would see further spread if we're not prepared with the high levels of vaccination coverage.
Okay, final question for folks who have vaccine skepticism. What is your message to them?
Well, this is a vaccine that was very effective in actually eliminating transmission of measles over 20 years ago. Very safe. We don't have reports of adverse events that in any way compare to the complications that we see of the disease itself. This is a highly effective public health measure, among the most effective public health measures to protect our population. And so the vaccine is very safe. The vaccine is very effective.
All right, Dr. Linda Bell, thank you so much for keeping us safe. We always love to have your perspective and your knowledge. Stay with us.